This is CBC Toronto News.
Tonight, the doses are here, but are they getting into the arms of Ontarians fast enough?
I'm looking for a sense of urgency.
The province being criticized for its slow vaccination efforts. The same day, health officials confirm 3 new cases of the more contagious COVID-19 variant. Plus,
all the families start to realize that our loved ones are actually in danger.
A record number of long-term care homes in the province are now experiencing COVID-19 outbreaks, the latest in the crisis. And
at this point in the pandemic, COVID-19 infection can be acquired anywhere,
with places of work posing a significant risk. The measures announced today by the city aimed at curbing the spread of the virus in vulnerable workspaces. Good evening, I'm Kelda Yoon. Ontario is facing criticism for not administering doses of the COVID-19 vaccine quickly enough. 3 weeks in, the province has administered just over 40,000 shots, while tens of thousands of doses remain unused. Now, the government says there have been bumps in the road, but as our Queen's Park reporter Mike Crawley reports, critics say the rollout is lacking a sense of urgency.
Yeah, how you feeling?
I'm good.
Long-term care worker Anita Quidonjan, with the Premier and Health Minister watching, gets her second and final dose of the Pfizer-BioNTech vaccine against COVID-19. She got her first shot exactly 3 weeks ago. Since then, the number of vaccine doses administered in Ontario is actually fewer than the number of new COVID-19 infections around the province.
With any rollout that we've had throughout this pandemic, there's a few bumps in the road.
The vaccine rollout has been disappointing in terms of its speed. We really have to get those vaccines from the freezers into people's arms.
Ontario has so far administered more than 42,000 doses of vaccine, but the province has another 100,000 plus doses on hand, ready and waiting.
The longer the residents of long-term care facilities and the people who work there remain unvaccinated, the more likely we're going to have longer outbreaks in long-term care facilities. That means more cases and more deaths.
While Ontario is vaccinating at a pace of a few thousand per day, Israel, with far less population than this province, has already administered more than 1 million shots.
I'm looking for a sense of urgency, a greater sense of urgency.
And the greatest urgency is in long-term care homes, where the pandemic has been the deadliest.
We know where these people live, so there's no reason why we shouldn't be making our #1 priority getting the 127,500 people in these homes vaccinated today.
Mobile teams from the University Health Network have made some progress on that, taking doses of the Moderna vaccine to some 1,200 long-term care staff and residents in the past few days. The province says it intends to cover all long-term care homes in the worst affected regions by mid-January.
Staff and residents, so that's fairly aggressive timelines.
We're ramping it up, and you're going to see a significant difference over the next few weeks there.
Mike Crawley, CBC News, Toronto.
Across the board, COVID-19 numbers continue to rise in Ontario. The province reported 3,270 new infections today. The 7-day average of daily cases in Ontario is now at 2,982. Meanwhile, there are now 1,190 people in hospital with the disease. 333 of those are in intensive care. The province also recorded an additional 29 deaths. And Ontario has confirmed 3 new cases of the COVID-19 variant originally found in the UK, bringing the provincial total to 6. All 3 cases are in the GTA and all are linked to travel.
I do want to take this opportunity to remind Ontarians to travel only if absolutely necessary. And if you do travel, you must maintain your quarantine for 14 days upon return to the country.
2 of the confirmed cases came from residents in Toronto and York region who recently traveled to the UK. The 3rd case was discovered in a Peel resident who had been in close contact with someone who had traveled to Dubai. The UK variant is said to be much more contagious than the original, though it's not reported to make the infection more severe or impact vaccine effectiveness. Meanwhile, the crisis in Ontario's long-term care homes has never been more widespread. Currently, 219 homes are experiencing an outbreak, a record. Chris Glover has the latest.
My grandma was crying in the phone, telling me that my grandma said, "They didn't give me water."
Just after Christmas, 96-year-old COVID patient Ping Chu was transferred to hospital from Tender Care Living Center in Scarborough. Yesterday, she died.
I just, I know she's now in the arms of God and she has no more pain and disease. But she was such a lively person just before the outbreak.
More than 60 residents there have died of COVID, and North York General Hospital has taken over temporary control. Chu's grandson is joining families accusing the home's operator of failing to have enough staff to protect residents.
I think the first wave that they went okay kind of gave us false sense of security.
Now a record number of long-term care homes are in crisis. Today, 219 are in outbreak, 12 more than yesterday.
A humanitarian crisis.
Today, the federal Green Party chairing a virtual meeting to call for immediate action.
By getting a swab before you go in and out is very effective, and we only have a few small pilots. It's unconscionable.
Ontario's Minister of Long-Term Care says enhanced COVID testing is catching infections sooner and pledged more money for staffing. At Toronto's St. George Care Community, dealing with the biggest number of active cases in an Ontario nursing home, finally some relief. Vaccines were given to residents there on New Year's Day.
We need a sense of urgency and we need a sense of emergency here.
Geriatrician Dr. Nathan Stahl demands a faster vaccine rollout inside nursing homes and enhanced restrictions outside.
The greatest risk factor for whether a long-term care home is going to experience an outbreak is the incidence of COVID-19 in the community surrounding the home. And we've never seen higher levels of community transmission.
As the military supported some homes in the spring,
it's almost too late for many of them.
Reed Zhao says while it's too late for his own grandmother, he wants the troops back.
All we need to do is ask why we haven't asked.
And here at St. George Care Community in the Annex, this is the largest active outbreak at a long-term care home in Ontario. But the good news is the home's operator tells me that the situation here is improving. There have been no new cases of residents contracting COVID-19 in the past 5 days. But still today, University Health Network has signed a voluntary agreement to take over control of this facility while it is dealing with this massive outbreak. Chris Glover, CBC News, Toronto.
The Provincial Commission looking into deaths in long-term care homes is being denied more time to complete its final report. The Commission is looking into how the province handled the spread of COVID-19 in long-term facilities. It asked for an extension until December 2021 to finish its report, saying it has faced significant delays in obtaining information from the government. But the minister responsible for long-term care, Mary Lee Fullerton, rejected the request. The Commission is expected to produce a final report by April 30th. Workplaces have been a big driver of COVID-19 since the beginning of the pandemic. Today, the City of Toronto announced it will now start publicly reporting workplace outbreaks. This comes as COVID cases in the city continue to surge, with nearly 1,000 new infections reported today. Angelina King has more.
Workplaces in Toronto are now required to immediately notify public health if 2 or more employees have COVID-19 or when there's a sustained transmission of the virus. Previously, Toronto Public Health grouped all workplaces together, but will now break them down into 11 categories, including grocery stores, pharmacies, construction sites, warehouses, and offices.
I believe this kind of transparency and public accountability will help to encourage employers to do everything they can to protect their workers, and it will help give everyone a better indication of where the COVID-19 virus is spreading.
The new rules apply to workplaces large enough to ensure staff privacy is not compromised. The city's Board of Health asked for this system back in September. Since then, workplace outbreaks continue to be a concern.
Because they're out there and many of them do require in-person sorts of work, It does continue to be a source of transmission.
Right now, there are 253 active workplace outbreaks in Ontario, the second highest source behind care settings. 16 are in Toronto. Since the beginning of the pandemic, more than 7,500 cases have been linked to workplace outbreaks across the province. So far, the WSIB has received just over 12,000 COVID-related insurance claims in Ontario. More than 8,700 have been successful, nearly 1,700 have not, and about 1,600 are still being looked at.
Probably our calls have definitely tripled.
A nonprofit that works to improve labor conditions says some workers have been worried their employers aren't following protocol during an outbreak and don't feel protected to come forward.
The city is trying to maneuver itself to try and, do what they can under their jurisdictional powers, but it clearly isn't enough. And we need the full weight of provincial labor laws to really deal with this for once and for all.
Most importantly, paid sick days, she says. She's also concerned the new rules put the onus on employers to self-report outbreaks. The city says it's asked for more provincial inspections to help.
Where employers don't comply, our medical officer of health can and will take direct interventions for that specific workplace.
Today, the city also announced further safety measures workplaces must enact, including limiting the instances when more than one person is traveling in a vehicle together, regular assessment of HVAC systems, and ensuring all staff are aware of the benefits and pay they're entitled to if they get the virus. Angelina King, CBC News, Toronto.
A police escort made its way from Hagersville to the Hamilton airport today to transport the family of the Calgary police officer who was killed on New Year's Eve.
Ton of emotions, overwhelmed once again by all of the support we're feeling here, obviously by all the local police forces that have taken the time to get us even to the airport and give us such an amazing exit of Ontario, and as we head into Calgary, to be in Andrew's presence today.
Brantford police say this is not a formal motorcade for Sergeant Andrew Harnett, but rather officers are escorting the family to the airport as a way to pay their respects. Officers from the Hamilton Police Service and the Ontario Provincial Police were also part of the escort. Harnett was killed during a routine traffic stop on December 31st. The 12-year veteran was hit and dragged by a fleeing SUV. 2 Calgary teens are now facing first-degree murder charges. A civil rights group is urging the City of Toronto to reallocate more than $300 million spent on police. It's based off a new report that focuses on 4 populations that it says don't require a police response. The report is backed by more than 20 community organizations and calls attention to the over-policing of Black, racialized, and Indigenous people in Toronto. Talia Ricci has more.
Say the humble get rewarded, and I'm still here waiting for mine. So much people doing bad and making stacks, my life's a lie.
Stolen from Africa is the type of nonprofit organization that a report today says deserves more funding, supporting youth who are more likely to have had negative interactions with police.
It actually gave me a reason to want to come to school. We don't really have spaces to talk about how we feel as young men, especially young Black men.
The Canadian Civil Liberties Association, along with other groups, is recommending the immediate implementation of non-policing alternatives in 4 key areas: homelessness, mental health, youth, and gender-based violence.
All around, we need approaches to be properly resourced that are alternatives to criminalizing people in these situations.
The report also calls for the rethinking of police control over the 911 system, since many emergency calls do not involve violent situations.
I have a son who also suffers from a mental health challenge, and instead of having himself tested for his mental capacity after an incident, he was incarcerated.
Some of the recommendations include reallocating $100 million in funds the report says are currently used to police people experiencing homelessness to more outreach and supports, $150 million to the expansion of mental health civilian crisis response programs, $65 million to youth hubs and outreach workers, and $25 million to programs that support survivors of gender-based violence, totaling around $340 million.
We are looking at every task carried out by the police. We are looking for areas in which those same tasks might be better carried out by other kinds of professionals, including mental health professionals, for example. And then, and only then, once we've identified a better way to do this, will we reduce the police budget.
These are concrete solutions that have been put in place in other cities that work, that keep us safer, and in fact, in many circumstances, are cheaper than what we're doing now.
And while the report lays out the research, Marley Lawrence can attest to the impact of community youth programs firsthand.
I made it a dedication. I was like, I want to come back. I want to volunteer. I want to graduate high school.
Toronto Police say it's reviewing the report and appreciates receiving community input on police reform, adding they'll have more to say soon as they prepare their next budget proposal. Talia Ricci, CBC News, Toronto.
We are just over a week away from the start of a pandemic-shortened NHL season, and once again, Leaf fans have high hopes for their team. The question is, can the Leafs live up to those expectations this time around? I'm Greg Ross. We'll have more on the Leafs' first day of training camp coming up.
And we have some gray skies on tap, and those are going to hang in there a little bit. I'm meteorologist Colette Kennedy. Few spots with a little bit of freezing drizzle, too. I'm going to illustrate all of that coming up.
To the hockey world now, Canada has advanced to the gold medal game in the World Juniors after beating Russia 5-0 today. The team will face the winner of the USA-Finland semifinal that's happening right now. And the Toronto Maple Leafs were back on ice today for training camp. The team has a little over a week to get ready for the start of the new NHL season. Greg Ross has more.
Back on the ice for the start of a new year, and with just 9 days to go before the start of a new season, the Leafs weren't wasting any time.
Started off with a bag skate, so I mean, got the juices flowing, and we had a good practice together.
Plenty of familiar faces were on the ice today, and also some new ones.
You know, I feel good. I feel comfortable.
41-year-old Joe Thornton is one of the veteran players the Leafs brought in to add leadership and toughness to a young lineup that for the past 4 seasons has not been able to get past the first round of the playoffs.
Whatever happened in the past really don't matter to me. I think just, you know, it's a new season, new slate, but just bring energy every day. Just be excited, play with no fear, and just enjoy the game. I think that's, you know, what I'm going to, stress these guys.
You know, I've been a leader on, every team that I've been on, so I'm going to obviously look to instill that into the guys and hopefully, keep pushing and, let my work ethic, kind of speak for itself.
It's going to be a season like no other. The pandemic has forced the league to completely change its format. The Leafs have been moved into an all-Canadian division and will only play the other 6 teams in that division throughout the regular season.
Being a Canadian, having all the Canadian teams in one division is going to make for a really interesting year, and it's going to create great rivalries and should be lots of fun.
Many hockey insiders believe the changes could work to the Leafs' favor.
The Canadian division this year, on paper, why can't Toronto win the division? There's no obvious number 1 contend team.
But because of their recent failures, there is more pressure on this group to win than ever.
If they don't win a round this year, there's going to be consequences.
The Leafs are scheduled to host the Montreal Canadiens in their season opener here at Scotiabank Arena on January 13th. But as it stands right now, the league is still waiting for permission from the province to play games here this season. League officials say they're confident they'll get that approval. The province says they're still considering it. Greg Ross, CBC News, Toronto.
And you're looking at a live shot of the Toronto skyline, a beautiful, mild evening out there with the risk of some freezing drizzle. Let's bring in Colette Kennedy for a look at the forecast. And Colette, a pretty nice, mild day overall, though a little bit gloomy.
Thanks, Kelda. Well, a nice day in the sense that our temperatures were kind of on the mild side, but you kind of have to like the color gray as well, because we definitely have gray skies, and they're going to be hanging in for a little bit, and just a bit of precipitation to go along with that. I'll kind of explain, because really we aren't dealing with active weather, and that's kind of what's nice about our pattern over the next few days here as we head through the week. So above seasonal, our temperatures tonight, we're going to be finding that the temperature only changes a few degrees from where we're at right now. A little bit of patchy freezing drizzle, a few areas with some isolated flurries tonight into tomorrow morning, even in some spots as we go through the day on Tuesday. So I'll explain that a little further too. And then as we get towards the end of the week, those temperatures, especially those overnight lows, you'll kind of notice they're going to get cooler as they go closer to seasonal for this time of year. But our daytime highs today, there just wasn't much of a range, exception maybe being Ottawa at -1 for the high. Otherwise, we're at freezing or just a tiny bit above. And because the winds are light too, we weren't really having to deal with much of a wind chill. And that's the case tonight and for Tuesday too. But look at this. It almost looks like an error in terms of there's just so much white gray here on my map, but it is not. That is, in fact, the cloud deck that we are dealing with. So it is definitely going to be stubborn. You can see, especially closer to the lake shores, a little bit of flurry activity. And again, just because where the temperatures are, a bit of freezing drizzle. So even tomorrow morning, there may be it's so localized, but a few spots where it's a little bit slippery on the roadways. Now, as we get towards Wednesday, late day, we start to see, especially towards the Golden Horseshoe, and Eastern Ontario, a little sun coming through. Much better chance of getting at that into Thursday, and eventually it's going to work its way into southwestern Ontario. But these mild temperatures overnight tonight, and again, looking at those temperatures tomorrow, very little change as to where we head to for the low and where we're going to for the high. Little cooler. Markham, Oshawa, you'll see a pocket of cooler air there to the north, so that's what's going on with your temperatures. But otherwise, 1 to 3 degrees will be our high as we look ahead at Tuesday and for Wednesday, we are talking about the sun trying to come out, and then we'll have a much better shot out, even though it's just a little bit cooler, Kelda, as we go towards the end of the week.
Great. Thanks so much, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
Coming up, a miniature exhibit portraying cities and regions across the country. We'll take you to Little Canada next. Finally tonight, with most travel plans out the window this year, a new tourist attraction may be your answer for visiting parts of the country. Little Canada is an exhibit featuring miniature versions of Canada's cities and regions. Its launch was pushed back because of COVID-19, but the creation of the tiny country continues.
Little Canada has a little day, 15 minutes. And every 15 minutes, the sun goes down. All the lights on the cars, on the buildings, the street lights, they all come on, just like they do in big Canada.
It's such a vast country, and I hope that this is a way of introducing other parts of the country to those who do not have the opportunity.
The exhibit goes countrywide from Niagara Falls and Toronto to the country's north. It's built to a 1:87 ratio with all the cars, people, and skyscrapers you'd see across the country. The little details are still being finished up, with the miniature destination set to open near Dundas Square in the spring. Very cool. And that's our show for you tonight. Thank you so much for watching. Dwight Drummond has your next local newscast tomorrow at 6, and I will see you back here tomorrow night at 11. Have a great night, everyone.